Welcome to the second video in the series of antihypertensive treatments. So today we're going to look at how blood pressure is regulated. And I'm going to share with you a drug summary I made and I also found in one of the textbooks I used when I was a university student. The drug summary, we're going to go through it together and then it will be available for you to print out. And there's a section where you can take notes, so print it out when the fifth video comes out of this series. You can make some notes on that document. Okay, so let's start this video off like the previous one and I have a question for you. The question is, alright guys, let's start with the question for this video. Now the question is it possible for a drug like aspirin to treat the ACE inhibitor induced cough in a patient on antihypertensive treatment? Okay, think about that one. I'll give you the answer at the end of this video. Now let's continue with how blood pressure is regulated in the body. Now two systems involved in the process of blood pressure regulation is the postural baroreflex system, and this is going to assist with your moment-to-moment blood pressure adjustments. Then the other system is the renal response. When you have a decrease in blood pressure in the renal system, the kidneys are going to make something happen and it's going to cause an increase in blood pressure. So that is the one that we'll discuss further now. Now the kidneys are important in controlling the blood volume and also long-term control of this blood pressure. So basically renin is going to be secreted. It's going to eventually lead to angiotensin II production, and this is going to cause three things to happen. Let's quickly look at the diagram. It's just going to make the explanation easier. So we start with angiotensin. Renin is secreted. It puts angiotensin, converts it into angiotensin 1. The angiotensin converting enzyme is secreted and angiotensin 2 is produced. Okay. This all is started off by a decrease in renal perfusion. And when we get a decrease in renal perfusion, the body is going to hold salt back, it's going to hold water back in the following 4 ways. Okay, now let's look at the first way. Angiotensin is going to cause an increase in sympathetic activity. Okay, then it's also going to cause an increase in the reabsorption of sodium, chloride and water, and it's going to cause an increase in the excretion of potassium. Then thirdly, angiotensin is going to cause aldosterone secretion, which is going to do the same as we discussed above. It's going to cause electrolytes to move around in order to increase the blood pressure. Then vasoconstriction is going to happen in the veins. And then lastly, the pituitary gland is going to cause ADH secretion. It's the anti-diuretic hormone, and water will be reabsorbed. Let's quickly look at some drugs that are going to influence the system. Now this is going to be some clues that I'm going to give you now for the diagram we're going to fill in just a while. So in the place of renin, inhibitor of renin will be allosterone. I don't know how to say this, guys. Okay, so you get your ACE inhibitors. It's going to inhibit the enzyme. So it works here, and then you get your drugs. It's called angiotensin receptor blockers. Okay, blockers, and they inhibit the receptors of angiotensin 2. Okay, we discussed now 4 mechanisms on how the kidneys can work to increase the blood pressure in a patient's body when they sense a decrease in blood pressure. Alright, now when a patient is hypertensive, we are going to administer drugs that's going to counteract this whole feedback mechanism of the kidneys, because we don't want the body to make the blood pressure any higher. Okay, now let's go into that drug summary before I answer your question. I hope you have the answer ready for me. Okay, this is the notes that we're going to use for the third video. It's going to come out later on this week, and we're going to look at the classes of drugs, the types of drugs in that specific classes, the mechanism of action, and there's a space for your notes. How considerate of me, hey? So just print this thing out or get it on a tablet or something and by the time the third video is released of this series, you're ready for it. Okay, so now I want us to together, we must fill in examples of this class of drug. Now there are a lot of clues, I mean really, but still it's just making this a bit interactive, I hope. So, for the first thing is the diuretics. The first class we're going to discuss is the diuretics. Now I already said thiazide diuretics. So, now this drug is going to block the sodium chloride transporter in the renal distal tubule, right? And it's going to cause an increase in the excretion of sodium, chloride, and potassium. Now, example of this drug include hydrochlorothiazide. It's almost like most common trade name in South Africa, I guess, is Reduc. Yeah. All right. Now, a loop diuretic works on a different place in the kidney or in the nephron. It's going to work in the loop of Henle. It also blocks the transporter of some ions, and an example of a drug in this area is furosemide. Furosemide, common trade name is Lasix. Alright, then we have the aldosterone receptor blockers. Now this includes all of our potassium sparing drugs. Okay, now amyloid and triamterene goes into this first one. Alright, and then they're going to block the aldosterone receptor, but actually all of them are going to do that, and going to increase sodium and decrease potassium excretion is going to be spironolactone and eplerenone. Now guys, these drugs are mostly given in combination with other drugs that are with other diuretics, so they potentiate the effect of other diuretics. But yeah, you can actually write that in your notes if you want to. Okay, sympathomimetic drugs stimulate alpha-1 receptors. Now a drug in this class is clonidine and also methyl-dopa. Methyl-dopa is a drug that's safe to give to pregnant women with hypertension in order to prevent preeclampsia. Okay. Sympathetic nerve blockers deplete noradrenergic stores. A drug that's going to work in this way is reserpine. And I don't even can think of a trade name of reserpine. Now let me quickly look it up. Okay, I found it, but it's basically just a renin reserpine. I guess it's not used often, that's why there's not a lot of that ones on the market, or especially in South Africa, because they have a lot of side effects. That does make sense. So, alright, the second one is the alpha blockers. Now, alpha blockers blocks alpha-1 receptors. Alpha-1 receptors are located in the veins, and an example of this includes prazosin and doxazosin. Now, vasodilators. Now, you get two types of calcium channel blockers. One that are more focused on the L-type calcium channels, and then drugs that are more focused on the calcium channels in the vascular system. So, the L-type calcium channel blockers include verapamil and diltiazem. Okay, and then more selective vascular calcium channel blockers will be nifedipine and amlodipine. Nifedipine is like Ciplalat, and amlodipine is like Amloc. Then drugs that cause nitric oxide release is like hydralazine. Now, if you haven't watched my video yet about angina, you can watch that. I'll put it in a card here up in my head. That thing will tell you a lot about vasodilators and how they work and how nitric oxide's effects on the body work and so on. Okay, ACE inhibitors. Oh, okay, this one is easy. Enalapril, ne? Pharmapress, very popular drug. And then angiotensin receptor blockers. Now this one is, an example is losartan. Okay, and then let's go to the next page. Renin inhibitors. We already discussed this on the diagram. This alloscreen, I can't really pronounce that. And then beta blockers includes ones that blocks the beta receptors selective or only. Then you get drugs that block both alpha and beta receptors, like the Carlock. Okay, then drugs that also releases beta blockers that also release nitric oxide include this one, nebivolol. And then just selective beta blockers includes propranolol, like Inderal, atenolol, and metoprolol. Okay guys, you can print out this summary, this drug summary for your next video. Video number 3 that I will be releasing soon. And then you can make notes on that last column that I indicated for you where to make notes. I'm so excited for you to use it. Okay, let's get, I know you've all been waiting for this moment. Let's get to the answer of that question I asked in the beginning. Now the answer is yes, you can use aspirin to treat an ACE inhibitor induced cough. And how this works is, this coughing is usually triggered by the production of prostaglandins, and aspirin is gonna inhibit prostaglandins. So hooray, you're gonna have a treatment of the cough by inhibiting the prostaglandins. Now you might be saying, but just in the previous video I told you NSAIDs are contraindicated in people with high blood pressure. Yeah, it is, but here we are going to look at a medium dose of aspirin. So not the one you're going to use to prevent blood clots, which is 100 milligram, and not the one you're going to treat inflammatory situations. You're going to look at around 500 milligram of aspirin. It's going to do just the job to inhibit the prostaglandin synthesis. Now, I've never got a script for this and see they actually use it in practice, but this is interesting to keep in mind, and maybe one day it's gonna boom, blow up, and we're gonna all use aspirin to treat an ACE inhibitor induced cough. Thank you guys so much for watching, and we're gonna finish off this series in the next video. And remember to print out that piece of papers that I put together for you and to make notes in the next video.